If you're dealing with anxiety, depression, low motivation, poor self-talk, poor self-worth, you just don't feel like you want to get going with things, or there's just something off in your mental health or your mental optimization that feels like it's holding you back, this video is for you. If you've gone through the counseling and the talk therapy and all of the SSRIs or whatever else that traditional medicine throws at you for these mental health optimization things, and you don't have that much success, things like TMS or neurofeedback might be great solutions for you and pretty much anybody in this mental health realm to progress and improve your nervous system, your metabolism, and your cellular health to better have good functions of mental health. There's a big theory out right now led by Dr. Chris Palmer out of Harvard of the metabolic theory of mental illness, and that how all mental illness is driven primarily by metabolic insufficiencies. Makes a lot of sense when you look at it, like when we're trying to fuel the brain, the motor, with your fuel tank, right? And if your motor isn't working well, let's see how the fuel is operating, okay? Because oftentimes, and especially in America, our fuel is poor. It's not even just suboptimal, it is poor. You have to really work and show effort to make sure your fuel sources are good. And it's not easy. And everything wants you to make the easier choices that are oftentimes less healthy for you. However, if you are dealing with mental health things, it is important that we fuel our system, period. Before we get into all of these fancy gadgets and therapies and drugs and all of these things, you have to fuel your system. It is basic. If my neurotransmitters are low, you have low motivation, there's your dopamine issue. Dopamine is driven by amino acids. Amino acids are your building blocks of proteins. Without tryptophan, without tyrosine, we are not going to make dopamine, period. There is no chances, zero chance of you making dopamine, no matter what drugs you're taking. And in fact, a lot of SSRIs are actually altering your neurotransmitter balances and how well you're actually able to produce neurotransmitters yourself. You gotta eat food. You gotta be diligent with getting good food into your body. That's the basis. I'll digress because I want to talk about what we do here at Axon, and these two particular therapies have been an absolute game changer for anything in mental health space. Whether you're dealing with a very heavy anxiety or depression or OCD or something that's seriously changing your life, or if you're dealing with a low grade of those things and it's just altering how you feel when you're driving to go see your friends, or maybe just when you're laying in bed with just you and your thoughts, you're not necessarily happy with those. Whatever spectrum you're dealing with, this can be extremely beneficial, and we don't have to wait until it's severe enough insurance deems necessary to pay for. These things are highly affordable outside of insurance. You can use them immediately without jumping through all the insurance hoops. TMS, or transcranial magnetic stimulation, we are using a magnet to transcranially induce an electrical current to these neurons, which will then fire those neurons, and what fires together wires together. If we get increased activity in a particular region of the brain, that might have to do with self-worth, or might have to do with depression or anxiety or sleep or eating habits or smoking cessation or whatever we're trying to achieve, we can do so by applying an electromagnet to those neurons and having them all fire together at a particular rate. We don't just stop with that here at Axon. And in the literature, TMS alone is ultra effective at all of those things. It is FDA approved for major drug-resistant depression. It is FDA approved for major depressive anxiety. It is FDA approved for OCD and smoking cessation. However, we don't have to wait till we get clinically deemed with one of those four things to use a technology like this and have benefits so that we don't get to that area. Right? None of us want to get there, and once we're there, it's a lot harder to back out of it. Let's prevent it, and let's get ahead of the curve so that our brain can always be moving forward in an optimized state. if you are already there, don't worry. This is where this machine shines. This is where we shine as Axon too. This being severe or maybe subclinical or mild or maybe something that you don't think is ultra important to address now, doesn't matter where you are on that spectrum, these things can help you. We don't just stop with TMS. We combine that and add that with things like neurofeedback. Neurofeedback helps to train your brainwave regulation. Your brainwaves are essentially how fast, how rhythmic, or how fast your oscillations of neural communication happen. Think of this as more of an identification of your transmission. So slow waves, things like delta, are active when we sleep. Theta, the next brainwave up, is active when we're kind of groggy, daydreaming, coming in or out of sleep. Next stage is alpha. This is calmness. This is focus. This is kind of being in that calm, focused state. Now we're getting into higher revving gears. Now we're looking at beta. This is cognitive load. This is driving. This is being alert. We're looking at high beta. This is high alert, high cognition, ultra brain demands. And then we look at gamma. Gamma is very hard to achieve in the regular population, but this is feeling in the zone, but being calm, calmly activated. Really, the only people that achieve gamma are monks in meditation or high-performing athletes in the zone. However, that range is important. We need the full range. However, when you're producing slow waves, when you should be in the middle of the day in like a work meeting, or you're producing fast waves when you're trying to go to sleep, you're going to have some issues. And that's not fun. And that's what neurofeedback helps with. So when we combine that, and again, neurofeedback alone is fantastic for things like anxiety and OCD and depression and sleep issues and food issues and sense of self and all of these things. However, when we combine it with TMS, it is a next level improvement in all of those things. We are essentially adding energy into the brain, and then we're training your brain how to utilize that energy efficiently. And when we do those two things, not only do you have an increase in energy, but you have an increase in efficiency, and your brain feels so optimized. You go about your day feeling just absolutely amazing. These things need metabolism and fuel to support ongoing improvements in. So we usually combine with supplements or lifestyle or IVs or things like hyperbaric oxygen, red light, things like that that are going to help fuel your system. But TMS and neurofeedback are your heavy hitters if you're dealing with mental health optimization or mental health dysfunctions. Regardless of what you're dealing with, neurofeedback and TMS can be huge players for you, and not only giving your brain extra energy, but teaching it how to use it and putting those bowling bumpers on so that you have better stress management and you can go about your day feeling a little more level-headed and having a little more energy. So if you are dealing with brain fog, anxiety, depression, fatigue, sleep problems, food problems, sense of self problems, relationship problems, give us a call here at Axon. Learn a little more about TMS, neurofeedback, and how metabolic support can help you and how that might be applied to you. Again, we build all treatment plans specifically for the person sitting in front of us. And if this is something that we think is going to help you, we'll let you know. If we think something else would be more beneficial for you, we will also let you know then too. However, if you're dealing with mental health issues or you want to optimize your mental health and your cognitive functions, give us a call here at Axon and we can get you on a plan that gets you closer to your goals and give you the tools you can use in your everyday life to get to your goals. You don't have to live with mental health issues. You don't have to live with just the little background things without anybody knowing. You can optimize these things and you could feel the best you can possibly feel. You don't need drugs. You don't need surgery. You don't need all of these other things that they're throwing at you. You need to regulate your nervous system. And that's what we do best here at Axon.